morning.
It is 11:35. We're going to go ahead and call this meeting to order. We are gathered here at the Public Health Office for the Drug and Alcohol Commission meeting. We're going to go ahead and start off with roll call. Colleen Rodriguez, present.
Earl Medina, present. Gerardo Montemayor, present.
Jesse Nam is present.
Elizabeth Alonso Villarreal, present.
Everyone,
Oh,
roll call.
Juan Hurd. Juan Hurd, Laredo Fire.
Present.
Frank Cordova, present.
Dora Maria Ramirez, scan. Philip Flores, present. Jessica Contreras, with Roots Recovery, present.
Richard Chamberlain, Laredo Public Health.
Erica Lopez, Laredo Public Health.
Catalina Agüero, Substance Program with Puerto Rico.
And the Bettis, Laredo Public Health.
Andres Velasquez, outreach coordinator for Congressman Henry Toya.
Nancy Cadena, Webb County Public Health.
José Manrique, Mazanuque. Fernando Lozano,
Thank you all so much for joining us today. Thank you for all that RSVP'd, and if you did not RSVP, please make sure that you RSVP, as it is important to ensure that we meet quorum. We don't see Pastor Davis here to do an invocation. Is there anybody that would be willing to want to do an invocation? If not, we'll go ahead and pass it forward. Okay, thank you very much. Ms. Angie, do we have any public comments?
No public.
Thank you. October 9th, we had a meeting, however, did we need quorum for that meeting? We did not need, do we still need to approve minutes for that?
The previous meetings, we did.
Okay, so then the meeting would have been September 11th. So we're gonna make a correction for the approval of minutes for the meeting that we did need quorum, which would be September 11th, 2024. Do we have a first and a second?
First.
I have a first, Carolina?
I'll second.
Is that Jesse?
Yes.
Thank you so much. I have a first and a second on the table. Can I have a, all in favor, say aye?
Aye.
Any opposed? Motion passes to accept the minutes as written for September 11th. Moving forward to our next agenda item is our administrator report, Dr. Chamberlain.
Good morning, everyone, still. I apologize for not being at the last meeting. I was out on, city business, traveling. But I did want to say that I know Jaime and Deidre have been working with the group to, give a little bit more to the branding of the Drug and Alcohol Committee as it's been in existence for a couple decades now, and we are very appreciative of the work that has been done. But we wanted just to make sure that the group has a logo or an emblem or a seal to stand behind. And with that, from the voting, this was the emblem, seal, logo that was voted on and had the highest amount of votes. So with that, I just wanted to make sure that the committee would approve through motion the updated logo that will be put onto the website. A letterhead will be developed, so if there's any communications that want to be pushed out via the group, that this would be utilized for all communications.
Okay. Do we want to put it into motion now, or does it have to be officially on the agenda?
Let's bring it back to the next one. Correct.
We'll make sure that we put it back into the agenda. Yeah.
Thank you.
Thank you. And we want to thank Jaime for taking that responsibility and having to push out different ideas for us to review.
Madam
So-
Chair, I'm sorry.
What?
Oh, no,
No.
I'm sorry. No, I just went back to the October minutes, so we're not gonna put the October?
There was no quorum, so technically the minutes don't exist.
Okay, so somewhere, there'll be somewhere where it says no quorum?
Yes. They'll have it corrected, yeah.
Okay, sorry.
Thank you, no, I appreciate that. Another interesting news, the HIDA, if we're all aware with the high intensity drug trafficking area, sent us a communication with this information, providing us a glimpse into 2023, which had 81 drug-related deaths of all intents occurring in Webb County. And as of September of 2024, there was 28 recorded. So that is a significant difference. definitely trending in the right direction based off of all the different harm reduction strategies that are being employed by each and every one of you all in this room, and then advocating for more, because that's what we need to do, is continue to elevate and multiply our actions and requests for resources to make that come in. So I've asked Ms. Adriana, who is our harm reduction specialist at Laredo Public Health and supports Roots Recovery as well, to make sure to continue to follow this, as this is reflective of death certificates, and we do know that some death certificates can take quite some time to be cataloged by the Vital Statistics Office here, and then of course at central office in Austin. But this was very telling, even though still one life lost is one life too many, and I've said that many times, but seeing this difference from 81 to the end of September, doesn't include October, is still good for our morale as a group, that we are doing good work and we need to continue to put some more pep in that step to make that difference to where we can ultimately have that dream of seeing that number at 0. I just wanted to remind everybody of the GIS map, and so that GIS map of course is live and active, and it has the 2023 data, as you can see down here at the bottom, and then of course it has the 2024 data. This is in collaboration with Laredo Fire Department, Laredo Police Department, Laredo Planning and Zoning, because we have our GIS professional there that is consistently updating this information that provides us not the geographic exact address or location, but where we can see naloxone administrations, overdose related calls and deaths reflective on this map by adding in the different layers here on the screen. So I just want to make sure that everybody still is very much aware of this tool, as it can be utilized for advocacy, grant applications. This information is there and provided through the city of Laredo. I just wanted to give some upcoming projects. We are piggybacking, and we want to give credit to Pillar for starting off with that vending machine that they do have at a couple of other locations, but we felt that it was very important for us to have the same operation at Public Health that would include different tests, harm reduction strategies as well. So there'll be naloxone, pregnancy tests, hygiene kits, condoms, that'll all be available for anybody to come to the vending machine, type in their number. Of course, it'll have information to refer you to any one of the programs here at the health department as well, but just maximizing our ability to address equity. And I feel that this is a health equity in action approach by making sure that accessibility to these tests or hygiene kits are readily accessible to anybody who comes and visits the health department, regardless of your socioeconomic background. Of course, targeting those who are less fortunate. I did want to discuss or just bring to y'all's attention the possibility of bringing the group together for a DWI, DUI awareness campaign for the holiday season. This is right around the corner, and if we can just come together over the course of next week, early, we can put something together Monday, Tuesday, Wednesday. It can be shared by Friday, and that's right before the Thanksgiving holiday. And then of course it'll continue to run on social media, and we'll push it out to our media partners within their guidelines, so we can have a presence over the holidays regarding DUI and DWI in Laredo. I also wanted to advise that we are expanding our footprint of our surveillance for high-risk substances in our wastewater surveillance report. As you all may know, we do have wastewater surveillance that does identify fentanyl, xylazine, methamphetamine, and cocaine in our wastewater, and their associated metabolites. We're still trying to gauge what the data tells us, because it's only been in existence since 2023 December. So we are coming up to a whole year where we can start to push out then basically an estimate based on a formula that they're developing at Princeton and Harvard of the actual usage of persons in the community. Like, I'm just gonna throw out a number for every 1,000 milligrams per liter of benzoleucanine, which is the metabolite of cocaine, there are 500 people that are using it. So if we get up to the 65,000 range of milligrams, then that's where we can start to figure this out and get a little more granular. So we're excited that we are having further developments within this realm and that we are adding additional substance use disorder treatments just to see what's circulating in the wastewater as well. Because right now we just observe naloxone, but we will be adding methadone and buprenorphine to it just for surveillance purposes as well. And that wastewater surveillance report is always accessible and it's published every week. And it's posted on the City of Laredo Public Health Department's epidemiology page. So this is the surveillance report. Of course, it's gonna give you, it's gonna give you the wastewater plants, but then it gives you the infectious disease part. So you'll still be able to get a little more information regarding respiratory infections that we do surveillance, that we provide surveillance for, gastrointestinal infections, other pathogens, and then of course ultimately the high risk monitoring, which this information is there for cocaine, fentanyl, and what we just discussed right now a few short moments ago. And with that, that is my report. I'll stand by for any questions.
It's gonna be, for the vending machine, like, the way Peter does it, like a PIN code to access it?
Yes.
Dr. Chairman, yeah, I just wanted to comment on some of the data you provided. It's wonderful to see the trends going down. I think, where we were 2023 to 2024, it's wonderful, and congratulations to Pillar, Scan, that does a lot of treatment, the City of Laredo who's out there doing all these things, the detox program. I was thinking about the detox program because we have it here, and even though we have a lot of, it's there, so we have a lot of people that are repeat offenders because they really go to detox, they don't really get some treatment, but they go back, and so that's saving lives in itself. But we have people that are repeating, and that it's there, and so that's, we have the naloxone, we have Pillar, we've got Scan with the prevention, we've got Scan with treatment. They do a wonderful job in treatment. I've noticed trends with people that I work with, clients, people that I talk to. I noticed that with fentanyl, there hasn't been as many fentanyl deaths. And there, I'm just thinking that it might be not only all of these factors. Obviously, fentanyl is still coming over. I think there's more awareness on the community about what fentanyl can do. And just like they did in Dallas, back in North Texas, when we had the big opiate epidemic in North Texas and a lot of young people were dying, they didn't know why. And here in Laredo, the young people weren't dying because the Tecatos would show them how to use heroin, how to titrate it. I think based on what I've heard recently is that you actually have people that are now gravitating toward fentanyl, but they've learned, they're aware of how powerful it is and they've learned how to titrate it. That's a suspicion I have based on a couple of conversations I've had because I was called yesterday by a mother of someone that's using fentanyl and just very worried because he's 28 years old, he's gone from heroin to fentanyl, and he's been using fentanyl for some time. And she said, well, what do I do? And I said, well, I explained the options. And I said, the one thing that I can think of that might help, because the person lives in San Antonio, I said, I referred him to some place. I told him, Mom, these are some places. But the one thing that I think may help is injectable naltrexone, Vivitrol, because that'll immediately stop, stop the opiate going into the brain and going to withdrawal. That's one thing that I do encourage us to look at. But I think we've done a wonderful job. Congratulations to everybody. But I think the people are now learning because of the awareness that we've created. They're aware of the dangers of it, but we still have the problem because people are still using it. And so a lot of great factors. Let's see if we can get it lower. that was just my thought when I was watching that.
Thank you for sharing that. I do also want, now that we're talking about the awareness of fentanyl, that we are coming up to the 89th legislator of the state of Texas. And right now, your voices matter more than ever, because they're going out, they're gonna start putting bills together. And I know through Laredo Public Health, even though we do not condone the use of any illicit drugs, we know that fentanyl test strips are a life-saving
Without a doubt.
device, a life-saving test. So we've sent out letters, and I know Senator Zaffarini has received those letters from us at Laredo Public Health, and so have our representatives, advocating for that to come back in this 89th legislature, because as I mentioned earlier in the year, in the 88th legislature, it was passed through the House. The governor flip-flopped from a no to yes, he wants them, but then failed as a Senate. So we have to bring that back, and make sure that fentanyl test strips are a life-saving device that are accessible in the state of Texas.
Yeah.
And I feel that this go around, if we can write our state senators, representatives, and even letters to the governor, letting him know that it's time, I mean, this needs to be accessible. We're not condoning the use, but people are going to use it. They need to know if their cocaine is laced with heroin. We don't want them using it at all, but we don't want unintentional death based off of
Yeah.
a weekend that they experience.
And that cocaine laced with fentanyl, is we're seeing a lot of that in the drug, last year with the people who were addicted to cocaine. And so, I think, the awareness that we still have fentanyl, and I encourage people that use the GIPR data for federal grants, like you all at Pillar, that do substance use treatment, make sure you document specifically fentanyl. You know, you're gonna document opiate, but, you know, opiate could fit a lot of categories, but we still have that crisis. You know, one way or another, we try to capture that, you know, in the programs I evaluate through an Excel sheet. If it doesn't have it on GIPRA, okay, what is this actual substance? And that way we have at least some data to show how many people are using fentanyl. So if you're in the detox program, go ahead and, because you don't use GIPR data, you know, keep an Excel sheet. You know, what is a primary substance of addiction? Why are they being admitted? So we have an idea of how many fentanyl admissions we have. I'm glad the numbers are going down. It's amazing.
I mean, you can see here from the fentanyl and norfentanyl in the system since we started surveillance on the usage and of course the excretion, right? Because this is
Yeah.
actual fentanyl being dumped into the wastewater. Maybe somebody's hot on somebody's trail, they're putting it into the system. We have corroborated that, and we have said that in the past with DEA when they see these spikes. Back at the end of last year and at the beginning of this year, they were hot on somebody's tail. And so this was just being injected into the wastewater system. They were flushing their product, their item. But we also see how we've seen we saw a little increase. There was a gap because of funding, but we got it back, y'all. We fought for it, and thanks to our utilities department for sponsoring it now on the wastewater side of their enterprise. So this is gonna be part of us going forward until somebody says no, which I don't think that they should say that. Maybe you all can help out if that no ever comes. But we saw that it has come down, and it's coming down, you know, that it's still in existence, but it's not where it was at the beginning of this year as well. So this data is also very telling for us in our realms as harm reduction specialists, organizations, but ultimately the epidemiology of what we're observing is trending in the right direction. But that doesn't mean we let up our guard, or let down our guard, rather. We continue pushing that forward.
Thank you very much, Dr. Chamberlain, and I will commend you, and I know that you're very humble when it comes to it, but it is your leadership that leads everyone else to doing this job, considering that we had this issue with the water. I guarantee that this issue would probably be something that they want to be able to keep. We want to know what's in our water, in our wastewater, and how to prevent issues like that. And it's data that could be useful for our organizations and also for grant writing purposes to bring more funding into our community. Adriana and Jaime, thank you so much for the support that you give to Dr. Chamberlain and Public Health, because it helps us get our mission out there. I want to commend and Erica, because talking about leadership and how leadership is very important. I just saw that you completed something with the City of Laredo. Do you want to share that with us?
So yesterday was our graduation from the City of Laredo Employee Development Leadership Program. It was a 10-month program, and it's the City of Laredo in partnership with Laredo College. Pretty much it's 15 individuals from different departments within the city. I was very fortunate to be selected for Laredo Public Health with the support of Dr. Chamberlain. And it's a very interesting program because you do go to different departments throughout the city. So we did go to airport and we learned so much about airport. We went to the utilities, we went to the water, we went to municipal court. And then the second part, you do gain a lot of leadership knowledge. So it was really great. Right now we're working on our final project, so hopefully presenting within this next month. But it's really a great experience, and I'm glad it came back. I believe it originated in 1997, and then it took a pause, and they reinstated it last year. So we're really looking forward to it. I know each year it gets better, and it's more competitive, is my understanding. So yesterday was a graduation. It was very rewarding. It was very empowering, and I think you see the passion that all the other departments have, and that kind of motivates you to collaborate together and not just with Laredo Public Health would say like, hey, we have this project we can do with municipal court or with community development. So overall, it was a great experience, a lot of learning. The 10th month honestly went by so fast, but I feel we've grown so much and we've bonded so much with other departments that like I look forward now to any new programs that HR has to offer because they're honestly great opportunities.
Well, congratulations and a round of applause for
I do have one more statement to share, and so via the Suicide Prevention Committee meeting, we had discussed the significant lack of care in mental health, whether for crisis at a hospital, people have to drive outside of Laredo, etc. We don't have that here. So via the Suicide Committee, as I was just mentioned, advocating at the representative and Senate level, we put together a letter because we see the power of it coming from the Drug and Alcohol Committee, but then the power of it coming from the committee and every single one of you all in the room, because that's not just one letter, it'll be 50 letters, right? So we did that with the Suicide Prevention Committee meeting, advocating for an extension of the San Antonio Hospital, the state hospital, to have even 24 beds here in Laredo would make a significant difference to be considered for that in the upcoming legislature. And so we, at the next meeting, if allowed, we can put that on the agenda and we can pull the letter that I sent earlier this year, edits and we'll put the document. What we did was, we'll share this, it's click on the document, put it on your letterhead, add your name, make any additional edits, and then send it out. And so at the subsequent meeting, if we can put that, if we can bring that to you all for December, and then so January we can loop back around because it's already gonna happen, right? The legislative session, we can ping everybody and say, we put together 25 letters that went out to advocate specifically in this realm for the legalization of fentanyl test strips. But of course, that's up to everybody's ability to do so, and we would just hope that the support is there so we can bring that to the next meeting as well.
Thank you. I've written it down so we can add it for our agenda for discussion and possible action. Thank you again.
And that was drafted with the help, of course, with Adriana and Ms. Erica, so I appreciate them very much.
Thank you very much. And I can't stress it. I think gratitude is constant, and you can say thank you and the work is there because it's an ongoing situation within our community. And while those numbers may be lower or that our efforts are still continuing, we don't ever want to just stop promoting and bringing awareness to our community. So it's really a passionate thing that we all have to be able to do. And that's why I say, like, if Erica was able to go through this and have that opportunity to level up on her leadership and collaboration, I think it's very important. And with that said, I want to make sure that every meeting that we have is a form of collaboration and opportunities to support one another because it just helps our community again, keep for our community to be safer and to have the knowledge out there. Which brings me to what we're going to discuss in a little bit regarding the policies and guidelines, so just bear with me. But again, thank you very much for that. I'm glad that opportunity was given to you, and thank you, Dr. Chamberlain, for your leadership, and Adriana and Jaime for supporting all of our efforts to make it happen. Thank you. Moving on, we've got, the detox, facility update is, are you representing?
Yes, Dr. Martinez couldn't be present today, her apologies. I'm Jessica Contreras, I'm the grants coordinator for the detoxification program. As part of our reporting and final progress report for this past fiscal year, the Detoxification Center, was licensed by the Texas Department and State of Health Services back in January of 2024. Officially, we did, serve our first client back in February 5th. And our fiscal year took us from February 5th, 2024 to September 30th, 2024. The Roots Recovery Center was to service 120 unduplicated individuals for that fiscal year, in which we successfully achieved detoxification services for 125 individuals. So we met our marker in that sense. So with that, takes us to this fiscal year where we did have our first, from October 1st to November, we have a total of 37 admissions. And we have been, more than anything, seeing an increase on females admissions, which is something that we were seeing a decline in numbers from past, this past fiscal year to this year. We've served 7 females and 30 males, this for, in the fiscal year.
Wow, those are some big numbers for the first month, so if we trend that, it probably will be a little bit higher.
Higher for
than
the
the
numbers.
last.
360.
Are there any questions that, Ms. Contreras can potentially answer, if she has the ability to do so? Any questions? Okay, thank you very
Thank
much.
you.
So with discussion and possible action, and regarding that, obviously, we're all doing our part. But we do have a lot of questions from community members regarding our policies and guidelines, and in order for us to be able to service them better, I think if we could all take the initiative, within our agencies to maybe do like a quick, and I know it's something that Jaime and I were working, or we were considering to work on. So if, with different scenarios in mind, so if somebody comes in and says, my teenage child has an issue with drugs, right? Where do we go? How do we go? How do we alleviate having to go directly to the detox center where they may or may not need those services, but we service them to another agency that might be useful for them. And so what I wanted to do is to review the policies or guidelines. While we're not changing your agencies or any of the policies, we just kind of want to make sure that we have that information so that we can put it together for our website. Does anybody have any ideas or any concerns regarding this?
I was, if I may, I was talking over with Adriana on that idea. So we're gonna keep that master one, and then she's gonna break it down into what you said, adults, children, family, XYZ, and then make a QR code and hyperlink it into the website. So it can be easy for people to read whatever they need, they can easily access.
Yes.
My question, how do we get listed on your list?
So submit the information via email to Angie. Angie will send it over to Jaime, and Jaime will include it with Adriana so that they can compile it into that list. And so pretty much what it is for like AMA. For somebody who's never been to AMA, what is AMA, right? So we're considering what is the mission of AMA? What is, the goal behind it? And who are you able to service? And what are the requirements at that point? So the requirements would be a form of ID, a referral from someone, and whatever else you may require. So the things that are going to be considered to assist this person at AMA. And so that goes the same way for anybody. So for example, Ms. Villarreal, at your agency, it's a nonprofit organization, but you do referrals for other programs, and you potentially may be doing like some form of counseling or presentations. Mm-hmm. So at that point, you put in your mission, and then some of the steps as to how somebody would, quote unquote, qualify or have the criteria to get the services that you are able to provide. And it goes for every other agency, the same thing with Webb County Health. But that way, we bring it to light and we kind of review and see where we're missing the services so that we're able to either start working towards providing those services to our community.
Back in maybe 2003, we were working on continuing care in the community. That not only included all of the providers, mental health, substance use, but all the other nonprofits in the agency, church groups, everyone that serves people. And the idea was each agency was supposed to have knowledge about whatever providers they had through a decision tree. And everybody referred to each other. So for example, if I come across someone that is a heroin addict that has had multiple treatments and has been unsuccessful, I'm gonna say, well, go to Fernando Rama, right? Or I see an adolescent that maybe is a runaway. Oh, we'll go to SCAN, right? And you know, I'm private practice. Same thing with anyone else in the community. If they go to a church, they ought to have the same resources. So we, at that time, developed a continuum of care. And we put it out there. When I say we, I mean the people who were working in substance use, because what was going on, there was a big gap in servicing co-occurring psychiatric and substance use disorders. People go back and forth. So, you know, as a group, you know, we came up with continuum care, and I think the one thing that might help is if, you know, when we are doing diagnosis, psychological diagnosis, we use differential diagnosis, we have a diagnosis tree. And if you can do kind of the same thing to agencies, say, well, you know, if it's child or adolescent, this is where they go to all the places. And that might help you guys.
Yeah, definitely, that's our goal, but we definitely need everybody's input in order for us to be able to put that out there for our community. And it's ever so changing, so you'll see it on the agenda, because just like trends happen, there's, you know, agencies that close down because of lack of funding, there's some agencies that come through because there is funding. So I know that you've all stayed consistent in having to support the Drug and Alcohol Commission. So we are asking for everybody to just kind of take the time to do a quick little page and information sheet so that they can be provided to Jaime and Adriana for our website purposes, and then to start creating brochures and other materials, promotional materials that are going to be able to assist us. Which brings me to the next topic, which is the Community Outreach Initiative to raise awareness about drug and alcohol abuse, particularly among youth. And I know it's something that Ms. Villarreal wanted us to include alcohol. We don't focus on it unless it's like in the season, like right now, which is the holidays, the DWI and the DUI awareness. And so, Jaime, are we gonna work out something similar? I know that Dr. Chamberlain had mentioned that he wanted us to do something. Are we gonna do something like audio, recording, video? What's the idea or the plan for it?
We were gonna do a campaign, like social media campaign, plus like a PSA and stuff,
Okay.
like how we did the past one.
Okay.
And in my opinion, alcohol has to be in the forefront every single day. It causes more deaths in society than all the other drugs combined. And, you know, the reason why we hear about drugs is, oh my God, fentanyl, you know, this, or heroin. But alcohol is out there every single day. In this week, I've had to send 2 people to detox and residential because of alcohol use. You know, I sent them a send, nothing wrong with this, but you know, what they were requesting, because they had co-occurring disorders, they needed a psychiatrist on site, and they needed detox, and they needed a good 45 days. And so, you know, alcohol needs to be right on the forefront. I don't know how long I've worked with LAD, and I'm dealing with the survivors that have PTSD because of people drinking. And people don't think, you know, people don't think, they get in the car and say, oh yeah, I can drive. There was a young lady that drank last week, and she decided to drive home. And she came, she told me, and she told me how much she drank. And I said, for your weight, let me show you what your blood alcohol content was. It was over 2 point something. And she's 17 years old, and she drove home. She left her house, got in a car, went to party, came back, and drove like that. She goes, well, I was the one that was least drunk, but I knew what I was doing. that's adolescence, but you know, that's how stuff happens. Alcohol has to be number one, I believe.
And if I may, and so LAD just released a, it's a 30-second, ad on TV, it's both in English and Spanish. You can find it on our website or at my own. Everybody is welcome to share it, just share it. We showcase just 5, only 5. We say there's many more, but these are impacts that are left that folks do not know. I mean, my son is it's almost been 13 years, and this morning I had one of those days, and, it just leaves people, it's not just you killed someone, it's the surviving, family members that have to carry that, especially, and at any age, we're looking at any age, there's younger folks, there's older folks, there's widows that are left having to, raise, children on their own. I mean, it's an everyday thing. So we have it out there, and we're gonna continue to show it throughout the whole year.
Yeah, it has to be. I mean, look, a couple of years ago when we had those young kids from Alexander that died. Okay, everybody was talking about it, and because I still work with adolescents, and I work with adolescents that are doing stuff like that, they were telling me where the party was, what happened, and you know what? The next week, they were still partying, doing that. It didn't faze them that they died. I have someone else that didn't meet the criteria for alcohol use disorder, wasn't alcoholic. Went to a graduation party, drank too much. It was a graduation of police officers, it was not in this town, graduation of police officers. Drank too much, she wasn't a drinker, let her leave, and got on the highway and killed somebody. And she's in jail. College graduate, business, when I did the evaluation, doesn't meet the criteria for substance use, didn't have mental health problems, she just drank, and they let her leave. Her friend let her leave. She took responsibility, and she's in jail, but it's a loss. A tragedy for everybody.
For everybody.
Alcohol needs to be out front.
And I think that is the reason why, regarding our community outreach initiatives, we need to bring awareness. Even though it's the season, it's year round. And thank you, Ms. Villarreal, for sharing that PSA. We were able to share it to the Drug and Alcohol Commission, social media, and then I was able to share it with Laredo Crime Stoppers, and I'll make sure that I put it on my tab. That way we share it frequently, because it is an ongoing issue.
Has anybody reached out to, we're thinking about reaching out to Laredo PD? I know they do some very good presentations dealing with alcohol too. I believe they have good demonstrations, if not mistaken. They have I believe it's called Fatal Vision, the brand.
Yeah.
They have the push pedals, simulates being under the influence, and a little course, it's a little simulation. I think they've done it at the schools before, I'm not mistaken.
I've seen those, and I know they've done it at the schools.
Yeah.
And all those are wonderful things, but I just have to remind everybody that what drives any substance use issue is a mental health issue that's not being taken care of. That's what drives it. And so, Dr. Chamberlain was talking about, the suicide awareness and all that. And I saw that article in Laredo Times. Worst in the nation for mental health. Okay, yet all of us in here, all of us that are psychotherapists, people that are in the field, we're working our asses off. We're out there. The thing is that Laredo has grown, and when I moved to Laredo, and I started working in this field over 36 years ago, we had 8 psychiatrists. Right now we have 0 because Homero had passed away. Dr. Rodriguez 2 weeks later had to go into the hospital. So we have 0 psychiatrists except the one that's at MHMR and Renee, who's at Gateway. No one in the community. We had 8 when I came in. And thank God we have people out there, but but underlying that substance use, we always have to remember, there's a mental health problem. That's how come people use substances. You know, it's not being dealt with, and a lot of it, I wasn't seeing a lot of kids for a while, and then when COVID hit, man, I'm packed with children and adolescents. Mostly I see adults. I treat trauma mostly, but you know, now I'm full of kids, all with anxiety, all with, and I see a lot of ADHD, and then again, in all the years, even from when Dora and I worked together, in the 36 years I've been in the field, I've never met someone that had a cannabis disorder, mild, moderate, or severe, that didn't have ADHD. Now, I've worked with people who have ADHD who don't use substances, but all the cannabis users have ADHD. And, you know, we have to get better. You know, obviously to have ADHD, you know, we need somebody to treat them, and we don't. I know the city of Laredo sent 50 referrals to Gateway for ADHD. Well, you know, they're backed up till January. Where are these kids gonna get seen? You know, we have issues. We have gaps in services.
And that's the reason why I feel like these meetings, thank you, Jesse, for chiming in. You're all more than welcome to chime in and put in your input so that we can obviously take this into consideration. We will look at Laredo Police Department. I'm pretty sure that they do that. But going back to, you know, the community outreach, we will participate with the DWI awareness, and hopefully with the expectation that we will keep it long-term, not only for the holiday season, but additionally, obviously planning for future community events, workshops, and educational sessions. You mentioned, Jesse mentioned, we all provide a different resource, and we have limitations to what we're able to do, but if we work together and collaborate, and let's say that public health is going to do an event, please send out that invitation so that maybe LAD could participate and do the part of representing the Drug and Alcohol Commission and providing that alcohol awareness. Additionally, with any other agency that we may be able to support. So with that said, if there are community events, there's workshop, educational sessions, I know Adriana was able to send out some of those harm reduction trainings. If those are in continuation, please send them out there. I know someone's reading the email, we'll put it out there. We wanna make sure that we take advantage of all of that and collaborate. We don't wanna have to duplicate any services because we're already limited to the services that we provide. So I always say knowledge is power, so the more that we know, the more that we are able to share, and the better that we're able to provide services to our community. So I want you to keep that in mind. If you have an idea, Ms. Alonso, Villarreal, if you want to be able to come to see something to light, let's work on it. Let's bring it up and let's work in collaboration. Because I know that Jesse has mentioned different scenarios, and I'm sure I want to be more proactive than reactive to the situation. Because while, you know, in this instance, a couple of years ago with the Alexander students, it happened, they reacted at that moment, but they continued, life went on, and they still did what they needed to do. So it's a constant reminder of, do you remember this situation? This situation may or may not be you or somebody that you know, and that is why you need to be able to, you know, be aware of it, to prevent it.
I apologize for my thing about alcohol, because that's one of my pet peeves. You know, it really bothers me that there's parties for children and birthday parties, and you have people drinking. What the hell? Come on, man. Oh, well, it's a cultural thing. Is it a cultural thing? I didn't grow up like that. It's a pet peeve that I have, and I will find that slide of the consumer care, because I used to make tons of presentations. As a matter of fact, when I taught CAMU, I would teach it to the students too. So I'll find that slide and I'll send it to you. But you know, when I think about alcohol, it riles me up, because I'm going to be watching football this weekend because the Aggies are playing Auburn. Okay, and I believe there's going to be at least one alcohol ad during the time I see it. And for those of you that watch professional football, and maybe you're not watching because Dallas is losing, okay, but there's going to be tons of that, and maybe more people are drinking because Dallas is losing, but it's not good. That's how come alcohol has to be an everyday thing. And you know, this is where I get on my high horse, because I I worked with heroin addicts for a long time, but alcohol, man, it'll kill you.
Yeah.
And it'll kill other people. Heroin addicts won't die from withdrawal, alcohol addicts will. It has to be done properly, the detox.
I know, the municipal court, Judge Chuy Dominguez,
Yeah, Chuy.
every 3 months or something like that, for the people to reduce some of the charges or something like that, the minor ones, he'll bring in different agencies.
Yeah, my wife used to go and make those
Text dot,
presentations, yeah.
Fire, PD, to speak to anybody, who comes in to dismiss the charges, the minor ones, obviously. And I know TxDOT and PD have a really good presentation.
The thing is, when you have, an addiction, it really is a compulsion, and you have this addiction, this dependency, you're already thinking irrationally, so even if someone dies, whether it's an alcohol, heroin addict, whatever, they say, oh, we're not gonna use anymore. I guarantee you, they're gonna use the next day or the day after, because their brain is wired that way. And, in order for it to not be wired that way, we need to give them time to heal. That's why it's so important for us to even start looking at what we're gonna do for additional, inpatient treatment. SCAN can't do it alone. We have tons of adolescents, and we have adults in setting that, but, we could fill that place up. You saw 135 people. 135 people, even if we had referrals, going to a residential facility, a 30-bed referral, that, it wouldn't even cover, 30 people for 60 days, 60 days, we wouldn't have, you're getting so many people, but we don't have that. And as legislative session is coming on, we have to continue to advocate for us to get more money, because we have always been the bastard children of the state of Texas. We get less money, we've had to fight and claw, and that's just a reality. And we have to be united. I was amazed when we used to go to the Dakota conferences back in the day, or the big conferences. All the groups were united, except for the Hispanics. They were always fighting. So why, we couldn't get the money, because, a lot of money would go to Houston because they're all united. The African Americans are united. A lot of money would go to Dallas because they're white, But they didn't care that we had the highest adolescent heroin admission rate in the state of Texas back in 1999 when I went to testify. They didn't give a shit because they're Mexicans. We're Mexicans. I'm sorry. It's a fucking truth. I'm sorry. Sorry.
Well, and that's why we need to focus on the fact that we are all advocates within our agencies, and that yes, we do need to stay united, and that we can't stress that our resources are very limited, but again, with much gratitude, we appreciate your advocacy, which brings us to the next topic of identifying gaps in services and potential areas for expansion. As we come through and we talk with each and every one through these meetings, or on the side, or within our personal work relationship, we do have gaps. There's an obvious gap. There's gaps in our services, and that's why, again, can't stress it, getting this information through Aliana and through Jaime, so that we can identify it and potentially open it up to the leadership of Dr. Chamberlain to look at potentially getting us that grants to go into each agency. I'm very proud of the work that everyone has done. It's a lot of work, and we never stop working. So I appreciate you all for all that you do. And so again, we need to work together and collaborate. So if there is an opportunity, and I've taken note of what Mr. Hurd has mentioned about the municipal court and having to do these presentations, these are awesome inputs, so that we can, look into it and potentially represent the Drug and Alcohol Commission, and have a member go out there and say, I represent the Drug and Alcohol Commission, and our mission is to spread awareness. And while this incident did occur, we don't want it to affect you or others. Because again, we know that there's different scenarios. There's different scenarios of mental health being ongoing, and there's that issue of it being like a social or cultural thing that we all get into. by being exposed to either alcohol or drugs. And so I can't stress it, knowledge is power and more awareness is definitely needed. So whatever events that you may have within your agencies, please make sure that you share it with Angie so that she can share it with the group.
And I apologize for my language, I just got very passionate because there was a time that I stopped working with adolescents for a long time because I'd been to too many funerals of adolescents. I stopped working with adolescents in 2005 after more than 15 years, and I didn't take them on again until 2020. I mean, I'd work them occasionally, but I just went to too many funerals. But I apologize, and you know, alcohol is my pet peeve.
Before we adjourn, can I actually address that once you're done?
We're still not in the, or we haven't even hit.
Sorry,
the
that's my
discussion,
fault.
so sorry. Jaime.
Yeah, we have an event coming up on Monday. It's a bi-national public health fair. Secretaria de Salud is also coming, so it'd be great for you guys to join us. I'm gonna send the registration form to Andy and she'll push it out to you guys.
And when is this?
It's on Monday here.
Monday here. Okay, send that information. If anybody else has information, we'll be happy to share it. I want to make sure that we get everybody through your lunchtime. It's only an hour. We've already hit the hour. So moving forward, I do want to discuss the partner agency updates. We don't have a presentation, so at this point, Alma, you can go ahead and briefly fill in on what you wanted to express.
Yeah, so we're gonna go ahead and share with everyone some flyers. We have gotten additional funding. So we actually have two MAT programs. One is federally funded, the other one is state funded. So we are able to accept from 30 to 40 individuals at this point. Because we have additional, because right now we're actually serving 330 opioid use disorder individuals. So we can actually serve 400. So we've actually hired more staff. We're definitely, prepared to take on, the workload. Just wanted to let you know.
Thank you very much for that. That's very good news.
Yes, and I also wanted to request you can provide a presentation, to the DAC members, so that way everyone's aware of Reference to Health Methadone works.
Yes, of course.
And if anyone is interested in any MOU with AMA, we're more than, happy to work with you all. And if anyone wants to tour our facilities, they can come down and make arrangements and we'll provide them a tour.
Appreciate that. I will definitely put you down for our next meeting so you can do a presentation and you can detail all this, other details that you are able to provide by creating MOUs or doing the tour at our facility. Thank you so much.
Thank you.
Ms. Nancy, do you have any updates? Anything going on with any clinics or anything going on? No, we're good. Thank you. Any other stakeholder?
I'm gonna do a super quick shameless plug-in for my program since we did talk about mental health. So with the Laredo Public Health Department, we do have the AOT program, which I am the manager for. So we do intensive outpatient case management, counseling, and psychiatric services for individuals 18 and over who are diagnosed with a serious mental illness. Like Mr. Jesse mentioned, most people with substance use disorders do have an underlying mental health condition. We do provide, right now it is virtual counseling weekly. They've been adapting very well to that. We do psychiatric care as well, where they usually see the psychiatrist every month as opposed to having to wait every 6 months. And the case management is twice a week in person, and then slowly it decreases as they're doing better. So 2 cases, even though we do not treat the substance component, one of our individuals who was smoking about 20 to 30 cigarettes a day is now down to 8. So even though he's not getting that treatment for substance with us, it's all mental health. Like Jesse mentioned, it does come hand in hand. We had an individual for the past 7 months testing positive for cocaine. Every time it was a different excuse. Never admitted it to it. Now finally he's testing negative. And he finally admitted it to it. Now he's actually more engaged in counseling. He's more welcoming to the counseling. So it is a great benefit, even though we don't directly treat the substance. The primary diagnosis does have to be either schizophrenia, major depressive disorder, bipolar. We have seen that treating the mental health component, it'll slowly decrease.
Yeah.
We had an individual as well who was heavily drinking pretty much like a bottle of vodka a day, plus beer. Right now she's just down to beer, which for most people would say it's still not a huge impact, but for her it is. And she got a job, she got a car, comes to every session with her child, and we entertain the child. He'll either be watching the Christmas tree or anything in the office, but she is very compliant to her appointments. So just wanted to do a little shameless plug-in, if you have any referrals, anybody that's been hospitalized more than twice due to their mental health or incarcerated, or we've even spoken to Roots because they do get treated for co-occurring at Roots, they would go ahead and qualify for the program. Our next court is December 11th, so we take care of all the paperwork, and then they would go ahead and be admitted to the program. It is civil court commitment, there's no charges, there's nothing pending, nothing on record for them, it's just part of the process.
And it's not shameless, because I really applaud you guys. You have a great staff. I have the numbers on my cell phone. I refer at least once a week because I get calls from all sorts of people and they can't afford private pay. But I do know, I say, hey, call Juan Rodriguez at the health department, ask for him. And you all have a great staff, I know. I know all your staff, and congratulations, because I do refer a lot of people to you all, actually, over Gateway.
Okay.
So, I do refer to Gateway, but I can let you know that, because I have a personal connection to all your counselors, I will do that. Right?
Thank you.
No, thank you for that information. Do we have anybody else that would like to share stakeholders?
With SCAN, I just want to announce that SCAN has both adult, male, and female residential units where we have the capacity of keeping them there from 30 to 90 days. And that we have available beds, and we also have for a male residential for the male unit. And so I also want to announce that, like Jesse had mentioned about the alcohol, yes, alcohol is one, that's my pet peeve as well. And SCAN many years took Peter Piper to court.
Yeah.
Obviously.
I was there.
Remember? And so, policies were changed where the kids were being bused in from the schools and they were serving alcohol in the pitcher. And because of the fact that we were able to go there, advocate on the fact that while the students are there, they shouldn't be selling the pitchers of alcohol. At least wait till after 3 when the kids are out of the unit. There was changes, and obviously we're always advocating whether it's tobacco, alcohol, any other drugs. And I just want to remind everybody that the Great American Smokeout is going to be November the 21st, and we encourage people that are smokers to please, make a plan. There's help, there's resources, and SCAN's available for any other services. So I want to thank you for giving us the opportunity to be here representing SCAN.
No, thank you for the information. I think, again, the more information, the more that we get reminded about the different things, and we help cross-promote your agency, as you all have, good information and resources available to our community that, again, they may or may not know. Do we have any other stakeholders?
I do have a comment. This is for the drug court. If anyone knows of an LPCA that wants or needs a job at $55,000 for a grant that's still funded for 4 years, that will get free supervision from me, so they don't have to pay $100 an hour. I'll give them free supervision for the entirety until they become LPCs. And so if anyone, of anyone that's an LPCA, someone that just graduated or that's interested, we have a position open this month. I know we have only one applicant so far, but we need applicants. And this is for the drug court because we shifted our model a bit. We still have LPCs on board, but we do not contract with agencies anymore. Everybody now is in-house, whether it's a drug court or a veterans court. So if anyone knows, they can give me a call, 956-337-7551. They can text me, and I will be happy to do the supervision and gear them towards maybe getting an interview.
So which judge is over the drug court now?
It's Judge Garcia now. It used to be Judge Hale.
Correct.
Judge Garcia is over it, and Judge Paloma is in the court. Judge Paloma was over the Veterans Court.
Thank you so much for that opportunity, Jesse, and sharing with us. So again, if anybody knows or has a friend or a family member who is going into a career, I think they would be very well guided with Jesse, because Jesse is very passionate, so we appreciate you for that opportunity. Anybody else that would like to share on behalf of your agency? Okay. It is 12:35. And we're gonna go ahead and call this meeting to order with a special thanks to Ms. Angie, who provided lunch today.
Miss Nancy.
Thank you,
Ms.
Nancy. It was
thank
great.
you. for the next meeting, Ms. Angie?
I don't have the form.
Okay.
Then I'll go ahead and.
Okay, so if anybody, again, would like to volunteer to bring lunch, please, by all means, get with Ms. Angie, and please, absolutely, RSVP, it is very hard, to ensure our, participation. We don't want to have meetings and not, have quorum, and then, of course, obviously not have discussion. We all have very busy lives, and there's obviously a lot of work that we have to get back to, so we wanna make sure that we are mindful of having these meetings and being prepared for them. So please, you all are leaving with homework, come back next month with information to please share with the rest of the group. With that said, it is now 12:36, and I'm gonna go ahead and call this meeting, to a closure, to adjournment. Can I please have a first and a second? I have a first
Second.
and a second. All in favor?
Aye.
Any opposed? Of course not. Thank you so much.